Hi everyone, in this video let's talk about clonazepam. Clonazepam belongs to a group of medications called benzodiazepines. It is well known with its brand name Klonopin, and nowadays a number of generic versions are available. It is one of the long-acting benzodiazepines with a half-life of around 30 to 40 hours. This medication can be used as an anxiolytic as well as an anticonvulsant. As it induces sedation, it is also used to induce sleep in a few people. In this video, we will explore key facts about clonazepam, like how it works in reducing anxiety and seizures, what is its effect on attention, what common side effects, how to take this medication, and what are the important precautions. First, let's see where this medication is used. Among the benzodiazepines, clonazepam is one of the long-acting medications. It also has high potency, leading to a low dose needed to show its action. One of the clinical uses of clonazepam is in the treatment of panic disorder. It is one of the anxiety disorders that is associated with intense fear along with a few physical symptoms like sweating, tremors, and rapid heartbeats. Clonazepam can produce a calming effect in such people by acting on a few inhibitory neurons in the brain. Clonazepam is also used to treat seizures, and it acts as an anticonvulsant. Particularly, it can be used for acute management of seizures. This medication can also be used in children to control akinetic seizures that cause a sudden loss of muscle tone. Lennox-Gastaut syndrome is a severe condition that involves severe, repeated jerky movements. This disorder may start in the early childhood, less than 4 years. Clonazepam can also be used to control such types of seizures in children. Another use of clonazepam is in the management of myoclonic seizures. It involves uncontrollable muscle movements that exist for a short period. It can affect the muscles at the arm and head and may cause muscle spasms. Clonazepam can control repeated activation of a few excitatory neurons in the brain that supply these muscle groups. This medication can also be used in a few other conditions, like restless leg syndrome. It involves an increased urge to move legs repeatedly, especially observed in the evening. Clonazepam is also given to induce sleep in people with difficulty sleeping. It relaxes muscle tone and improves symptoms of rapid eye movement sleep disorders. How it works? Clonazepam works by calming a few neurons in the brain. Neurons play a key role in the transmission of signals from higher centers of the brain to the various organs of your body. This communication is facilitated by a few of the chemicals called neurotransmitters. Glutamate is an excitatory neurotransmitter that stimulates the target organs where it supplies. It can activate a few centers in your brain that increase wakefulness and reduce sleep. They can also increase anxiety. In a few people, these neurons are excessively activated, which may result in the induction of seizures, panic attacks, insomnia, or anxiety. However, the action of glutamate can be controlled by another mediator called gamma-aminobutyric acid. It is an inhibitory neurotransmitter that acts through GABA receptors. Clonazepam works by facilitating the action of GABA on its receptor. It binds to a specific site on GABA-A receptors that promote binding of GABA to its binding site. This opens chloride channels, which enter the target cell, leading to a negative potential within the cell. This results in inhibition of the target cell and prevents its excitation. This can control stimulation of neurons and reduce symptoms of anxiety and seizures. How to take this medication? You can get clonazepam tablets in 2 variants: immediate-release tablets and orally disintegrating tablets. The latter are also called dispersible tablets that can be used in people with difficulty swallowing. However, these tablets should be handled properly, and they shouldn't be taken with wet hands. Once opened, they should be swallowed with a glass of water. Immediate-release tablets are available at different strengths, starting from 0.5 milligrams to 2 milligrams. Orally disintegrating tablets are still available at lower strengths, starting from 0.125 milligrams. This medication should always be started at the lowest dose possible to eliminate significant side effects. The dose of clonazepam depends on various factors like age, patient conditions, and purpose of use. It can be given either as a single dose recommended to be taken at bedtime or as multiple doses. For treating panic disorder, clonazepam may be given to you initially at a dose of 0.25 milligrams given twice daily. After 3 days, the dose may be increased to 1 milligram per day. For treating seizure disorders, it may be given at a dose of 1.5 milligrams per day initially. It can be given in 3 doses at equal intervals, each containing 0.5 milligrams of clonazepam. The dose for inducing sleep may vary depending on many factors, and it is variable from 0.25 to 2 milligrams. However, it is always better to start at a low dose as your body slowly adjusts to this medication. It is given 30 minutes before bedtime to induce sleep. Never stop this medication suddenly, especially when you are using clonazepam at higher doses. It may cause withdrawal effects if you suddenly stop. It is more important when you have used this medication for longer than 4 weeks. Your doctor may reduce the dose of clonazepam slowly over a few days in such cases. Side effects. In many of the people, clonazepam is well tolerated and very few minor side effects are observed. But with an increase in the dose, few common side effects are observed. One of the common side effects of clonazepam is somnolence. That means it can make you feel sleepy and drowsy. Being a benzodiazepine, clonazepam can cause CNS depression. Therefore, you may have sedation and dizziness. You can also have a few illogical dreams occasionally. It can also produce motor impairment that can cause trouble in movements. This side effect is more pronounced in elders, and it may result in loss of balance. Particularly in the elderly, clonazepam can cause memory impairment. They can have a state of confusion along with sedative effects. However, this affects loss of short-term memory, forgetting things in current events. Effect on attention. Clonazepam may impair your attention, and it may cause daytime sedation. Since this drug stimulates a few inhibitory neurons in your brain, it can cause central depression. Especially, sedative effects are more observed in the early days of therapy. That's why it always started at a low dose, as your body needs an adjustment to this medication. Therefore, be cautious while driving or handling heavy operations until you feel normal and alert. These daytime sedative effects may slowly disappear with continuous use. However, a few other conditions can exaggerate these sedative effects. If you're taking any other medications like antihistamines that are used to treat colds and allergies, this sedative effect may be more enhanced. Taking alcohol can have serious effects on sedation and drowsiness. Therefore, avoid the intake of alcohol while using clonazepam. Taking with opioids. Opioids are the steroidal medications that are used to control pain. They work by inhibiting a few neurons in the brain that elicit pain signaling. These medications can have a depressive effect on neurons, and they induce sedation. Therefore, never combine opioids with clonazepam. This can severely impair your attention and cause severe drowsiness. It can also lead to the induction of coma and even death. Clonazepam can increase salivation, so if you find any excessive salivation, you should talk with your doctor. At very high doses, clonazepam can cause depression of your lungs. Therefore, avoid clonazepam if you have severe difficulty breathing and shortness of breath. In the later stages of pregnancy, use of clonazepam can bring depressive effects in newborns. Infants may have drowsiness and difficulty feeding. It also secretes into the milk. Therefore, clonazepam should be carefully used in pregnant and breastfeeding women. Withdrawal symptoms. Suddenly stopping intake of clonazepam can reverse its effects. Normally, this medication induces sedation, sleep, and reduces anxiety. It also reduces the incidence of seizures. If you suddenly stop, these effects are reversed, leading to withdrawal effects. On sudden withdrawal of clonazepam, you may have increased anxiety and irritability. You may have difficulty sleeping, tiredness, sweating, and seizures. Therefore, never stop it suddenly. And in case you want to stop this medication, gradually reduce its dose over a few days. These are the important things about clonazepam. That's all, guys. Thanks for watching this video. Have a great day.